Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. And this case review that I'm about to break down is gonna be perfect for you if you have some type of butt, calf, leg, maybe even foot numbness and tingling, pins and needles, stuff like that. That gets worse when you're standing and when you're walking. So lots of people I work with, they feel pretty good when they're lying down or when they're sitting, but when they go to stand, their symptoms in their leg intensifies. This is actually a pretty classic presentation. I'm going to talk about what it most likely means and then walk you through the step-by-step process that I would use in complete, full exposure, full transparency detail so you can start to think differently about the way you go solving this problem naturally. So hopefully it's helpful. Let me know. Stick around for the entire case review so you can see the entire 4-step pain relief process that I bring people like you through every single day. Oh, and by the way, if you'd like to determine the most likely source of your back, butt, or sciatica problem for free, go ahead, click the link above to download my Better Than an MRI DIY diagnostic guide, or click the link below in the description. Okay, so let's dive into it. Let's review the case of a gentleman named JT. I know the picture doesn't necessarily reflect that, but he's a younger to middle-aged male with pain in his glute, in his hamstring, and in his calf. We're gonna do about a 60-second rundown on his specific case using what I call a case review submission. So I work with people all around the world dealing with back, butt, or sciatica problems. This is my exclusive specialty. And so when people reach out to me, I ask that they submit a detailed case review so that I can get all the info I need to start to figure out a plan. We're going to talk about the diagnosis. We're going to talk about what this person needs to do to optimize their healing environment. We're going to talk about what this person needs to track and what I recommend you track to figure out if what you're doing is working or not working. And then we're going to talk about getting back to life, how to know when you're ready and what that might look like. Okay, so overview, 60-second rundown. Here we go. So you have context, and we're going to break everything down. All right. So JT, younger middle-aged male, worst pain, 9 out of 10, pretty high, right calf, sometimes hamstring when walking or putting weight on his leg. 6 weeks, it's fairly recent. What originally caused the problem? He's not really sure. All right. Had some glute pain, then some back pain, but the back pain has gone away. Zero back pain. Can only walk like 20 steps or so. X-ray was negative, has not had an MRI yet, which is actually good news, and he's waiting to see a specialist. We actually probably want to keep him from going there so he doesn't fall down the rabbit hole. They think he has sciatica, which means they're really unsure of what's going on. His symptoms are consistent day to day. He does not have delayed pain, meaning he doesn't have symptoms that, he's fine while doing things, but then it kicks up later. His symptoms are immediate in the moment. He does describe symptoms that may move or shift around. We'll dive into what this means. Stress does not impact his symptoms, and if he's distracted, it doesn't matter. There was no significant life event that he can recall that happened around 6 weeks ago. His symptoms are fairly recent, although he has been stressed for the past 2 to 3 years. Okay, again, walking and standing is the main driver of his symptoms. He's not really sure what makes him better. He says maybe a figure 4 stretch, but my guess is it's just temporary, and then the problem comes back. Hasn't been able to walk normally for 4 to 5 weeks. And then I asked people to go through sort of a self-movement exam, because I believe that you watching this right now know what you're feeling better than I do. All right. And so I have you go through your own motions and sort of rate what things make you feel worse. He said, hey, I've got a yucky right leg raise, which is where you sit and you kind of kick your leg up. I've got a yucky forward bend and a yucky back bend. He has no weakness because he can go up on his heels. So his L5 nerve, and we'll talk more about this, his L5 nerve is at least appears to be healthy. He can go up on his toes. So the S1 nerve controls the ability for your calf to have the strength it needs to go up on your toes. No loss of bowel or bladder function. These 3 questions just let me know that the nervous system is healthy. Right. And which is really good news, because what's the intent of, say, a spine surgery? Maybe you're watching this like, oh my gosh, my pain is so bad. Do I need spine surgery? Well, if you don't have signs of what we call neurological loss or weakness or loss of feeling, then it tells me, yeah, your nerve might be angry or ticked off, but it's not damaged in the sense of losing function, losing strength, losing the ability to feel or sense things. All right. So no history of cancer is a big one, because the previous history of cancer is the biggest predictor of cancer as the cause of maybe back pain or something like that. I do ask if there's any other significant medical history. Just says some left knee stuff a while back. He does mention, though, that he has had a history of back pain, even though this is just 6 weeks, for the past 8 to 10 years, although it's getting worse, right? This is the worst that the pain has been. And you'll see that commonly. You'll see that, hey, back goes out, it's not too bad, gets better. Back goes out, not too bad, gets better. And then it becomes more frequent. And before you know it, it's shooting down the leg. All right. And that's what he's dealing with right now. He's tried lots of different things. All right. Significant impact. And again, doesn't have any back pain, but can't walk or stand for more than 2 minutes. And, he can't play golf, so that's not cool. All right, so that being said, let's dive into the first step that I would take with someone to kind of synthesize this, right? So there's a lot of things going on here. So what do we do with that? How do we start to develop a plan from it? So I'm going to walk you through step by step exactly what I would do and how I would go about thinking through solving this problem naturally. All right, so the first step to determining how we're going to resolve your pain or the direction that we may take is to determine the most likely source of your symptoms. So are your symptoms of the body due to physical damage in the body, an injury or something like that? Or are they due to a centrally sensitized nervous system due to your mind or due to your brain? Believe it or not, pain can be created, very physical pain, physical sensations and symptoms can be created by your mind. So as much as we're wired to believe that all physical pain that we feel is due to a problem in the body, an issue in the tissues, it's not the case. So let's zoom out first, right? And let's determine our symptoms of the mind or of the body for JT, but you can follow along and do this for yourself. Okay, so what you're seeing right here is a little bit of a snippet or a snapshot of sort of what we call an evidence list, all right? So what we've done is we've outlined 13 different questions. And then you can see you've got an answer column here, yes or no. And then there is space for you, or in this case, I just copy and pasted from the case review that JT provided us, the evidence that either supports or refutes your answer. And then what's going to happen is it's going to give you a readout of the probability that your symptoms are of the mind or of the body. And then if they are of the body, well, then is it a piriformis problem, a disc problem, sciatica caused by something like spinal stenosis, disc issue, etc. I just copied and pasted the answers that JT indicated on his case review, and then I answered appropriately. So just to go through them, you can read them here though. Are you unsure as to why your pain began? No clear injury or cause. He didn't really mention anything, right? So he had a lot of I thinks and I feels, which means there wasn't probably an injury. If you have to think or feel as to what caused your problem, probably didn't happen, all right? So no clear injury. So I'm going to say, yes, he is unsure. Is the pain chronic? Well, no. 6 weeks of symptoms. Did your pain begin around a time of fight or flight? Even though he's been stressed out for the past 2 to 3 years, there's nothing really specifically. So the answer is no. Is your pain consistent day to day, right? Or are there good days, bad days? And he says, no, my pain is consistent. So we push no on that. Does stress trigger pain? Again, even though he's in a stressful time in his life, he said no. If you're distracted, does it relieve your symptoms? No. Do you have pain or symptoms elsewhere in the body? Lots of times people have maybe GI issues or headaches or migraines or neck pain, shoulder pain, knee pain, lots of other aches and pains that can't well be explained. In this case, he didn't mention any, so no other mention, no. Does your pain shift, spread, or move around for unclear or unknown reason? And he said, yes, it does do that. Do you experience delayed onset of pain? He said, no, it happens immediately in the moment. Have you been given many or no clear diagnosis? In all fairness, he hasn't really seen what I would consider to be a lot of diagnosticians. So I'm just going to say yes here because he did say they are unsure and that they think it's sciatica. They're not really set on a diagnosis yet. All right. Do you identify yourself as a high-pressure perfectionist, people pleaser, type A, good student, get her done type personality? Right. The reason I ask this is that we know that these folks tend to be a little bit more elevated in their state, a little bit more wired. They live in a little bit more fight or flight, and that can increase the sensitivity of the nervous system and lead to ongoing pain, believe it or not. I just have a question mark there. I'm going to give him the benefit of the doubt and say he's not like that. All right. Not that it's a good thing or a bad thing, but there are pros and cons to being like that. All right. Is it hard to identify yuck emotions that clearly and consistently reproduce your pain? Problems that are due to issues in the body, disc problems, nerve issues, you can find clear and consistent motions that make these things worse. Versus symptoms that are more of the brain, they're generally a little bit more mucky, a little bit less clear. Oftentimes people will say, I don't have any clear yuck emotions, or all my emotions feel fine, I just can't sit or drive or bend or whatever. That points to more of a brain thing than a body thing. In this case, we're going to say no because he can clearly and consistently identify emotions. So both the back, moving forward and backwards, and then raising the leg, pulling on the sciatic nerve. And then finally, has there been a lack of response to physical treatments? Regardless of the quality of these physical treatments, I don't know what they look like or what exactly that entailed, but he's seen many different people despite not having it for that long. So I'm going to say yes, there has been a lack of response to physical treatment. Now, the cool thing is that we've done the hard work for you. So again, diagnostics occur in probabilities, All right. And what I mean by that is that it's rarely ever 100% this. Everyone wants to know what's the cause of my pain, right? And they want to know for sure, like black and white, but it's a little bit gray. So we go off the probabilities. And in this case, you can see this tool that we've created indicates that there's a 69% chance or probability that his symptoms are of the body, structural issue, damage of something in his body, versus a 31% chance that symptoms are being driven centrally by his mind or by his brain. And by the way, again, whether it would have been the opposite, let's just say it was 69% mind. Maybe you go and you fill something like this out and you do your little calculation. You say, oh my gosh, it says 69% chance that it's caused by my mind. It doesn't mean that it's not real. It's very real. If you feel the pain, it's real, okay? So in this case, symptoms are most likely due to an issue in his body. So what would that look like? Let's talk now about the diagnostics. Pain that presents with, there was back pain, Charlie. I have a history of back pain. My back goes out on me after golfing, lifting, bending, at the gym, whatever, gardening. And then it goes away, and then comes back, and then it goes away, and then it comes back. Again, this roller coaster of pain. And then this time, I had some back pain, but I have zero back pain now. It's disappeared. And instead, I just have a pain in the butt. It goes down the leg, and oh my gosh, my calf is on fire, and then I get some numbness, tingling. If we think of the diagnosis, the potential diagnoses, as sort of like a deck of cards, right? We've got our deck of cards here, and it could be piriformis syndrome, right? It's one possibility, and lots of people would say, well, I don't have any back pain, Charlie. I just feel pain right here in the butt. And so my back is fine. It's a buttock problem. It's a piriformis syndrome problem. Again, a lot of people would say, hey, we think it's sciatica. So I guess you could put that in the list of cards of diagnosis, but sciatica is really a symptom of something greater. So whether it be piriformis syndrome, spinal stenosis, or this presentation, very consistent with a disc issue, and likely what we call a disc extrusion or large protrusion. Disc extrusion or large protrusion. Younger gentleman, or it could be younger female, but in this case, it's a gentleman who had back pain, history of back pain. Now the back pain has gone away, no back pain, but my leg is on fire. And oh, by the way, I can wiggle this joint right here when I bend forward and when I bend backwards. And when I go and I try to kick my leg up and I pull on that wire, which is the sciatic nerve, all right, I get zapped. That tells me that chances are high, this person does have sciatica, very high, but the probability they don't have it is very low, let's put it like that, that it's a back problem. And no back pain or back pain that was there went away. Now my leg is on fire. And by the way, how can we prove it's a back problem? They might not have back pain, and you could do this as well, right? Maybe you just have a pain in the butt going down the leg, but you don't have any back pain. Well, if you bend backwards, so watch me here, if you bend backwards, straight backwards, right? Or if it's on the right side, let's just say, twist to the right and bend straight backwards, or twist to the left and bend straight backwards. And if you kink down on that area by, again, wiggling these joints in the low back, you'll generally pinch or irritate the structures in the spine, which then refer pain or shoot pain down the leg, right? And you might say, well, okay, so you're saying, Charlie, it's a disc extrusion. Disc extrusion, disc protrusion. By the way, no MRI needed in this case because the clinical picture is so clear and something that is so predictable that the likelihood of it being something else is very low. And so again, diagnostics occur in probability. So when we think of the deck of cards, well, it could be this, it could be that, right? Well, Charlie, it could be a tumor. It could be a fracture. Well, what if this? What if that? Yeah, but probabilities, all right? So again, disc extrusion or large disc protrusion such that bending forward and bending backwards ticks it off. And you might say, well, disc problem, Charlie, these people love standing and walking. If you have a disc problem, you're supposed to get better with being in a position where your back is more upright. What's up with that? All right. In this case, this person will generally feel much better when they're lying down or when they're seated compared to when they're standing or walking. And by the way, bending backwards will make this person worse. Bending backwards will make this person worse. And how do we know that? Well, they told you that bending backwards makes them feel yucky, but here's what will happen. And we'll get to this when we talk about the treatment as far as exercise. So this is bending backwards. Hands on hips, bending backwards. There's the person's eyes and nose, all right? And then what happens is this. You say, oh, you have a disc problem. So they lay on your belly and they have you do lots of different press-ups. Well, that is also bending backwards. Bending backwards, it's just in a different position. All right, so don't let someone fool you. If you've got a yucky back bend, you've got a yucky back bend. And we do know that if disc extrusions or protrusions are present or large enough, then bending backwards will actually reduce the space where the nerves travel and cause further problems, actually increase the size of the disc bulge potentially, all right? And so don't let this idea of, again, diagnosis guide the treatment too much. So you have a disc problem, the classic way to treat it is to do lots of press-ups, right? Do lots of nerve glides. But in this case, again, doing nerve glides is yucky. Stretching hamstrings is going to be yucky. Again, doing lots of back bends, press-ups, cobras, things like that also will make this person worse, as will probably bending forward as well. So we'll talk about what we do if forward and backwards, if northbound and southbound are jammed, all right? Now, that's the diagnosis part of it. So we talked about, brain, body, and then within body, right, we've got disc, extrusion, no need for MRI, save your time, save your energy, save your money. You'll do worse if you get an MRI in this case because it'll push you down the path of pills, shots, or surgery. But we know that the health of the nerve still remains because this person doesn't have weakness. They don't have loss of feeling based off what they're describing. So let's go through the process. All right, so how would we go about resolving this? Or how would we go about resolving your symptoms if you have some type of back, butt, or leg pain in this case, or calf pain, foot pain, right? That is worse while standing and walking, and you present in sort of a similar way. Or even if you don't, the same process applies. All right, so here we go. 4-step pain relief process. We optimize the healing environment mentally and physically. The idea is you cannot exercise a bad diet. You can do all the treatment that you want, but if you're pouring fuel on the fire, you're not going to get better. You'll hold yourself back. Then we self-assess. You can't manage what you don't measure. Right? You've got to have a tracking system and know what to look for so you know if you're getting better or not. Movement is medicine. The goal is never to take more medicine than needed. Take as much as needed, as little as necessary. Movement as medicine. We teach you how to use your mind and movement as medicine. So the goal is to find the one motion that's going to work best for you, right? And then back to life. How do we get you back to life as quickly as possible with the least chance of reoccurrence, right? So let's dive through this as it relates to this specific scenario. We never begin with exercise. That quote says it all. You can do all the exercise you want, right? But in the case of losing weight, you won't lose weight if you eat donuts all day. Doesn't matter how much you run on a treadmill. You won't improve. No matter how many times you get your back cracked, no matter how many pills you take, you generally won't improve if you're constantly ticking the problem off. So in this case, this person has trouble standing and walking. And so there's a couple things we could do, right? First things first, when we think about optimizing the environment, we think of optimize things mentally, fears, worries, beliefs, concerns. Beliefs inform your actions, which inform your results. So to start, we need to educate, right? This person needs to know what pain is, experience of the brain and the body, protect you from some perceived threat, perceived or actual threat or danger. In this case, it sounds like there is an actual threat. This person probably dinged a disc in their spine and it's irritating their sciatic nerve. The good news is, right, if they know, right, that most people with these issues will get better in a 3 to 6 month timeline. Well, the person might say, well, that really stinks. I don't want to know that. But point is that there is an end in sight. If you take the right approach, this is not something generally you have to live with. And oh, by the way, you look at a picture of this. So let's just say this is your spine from the side, all right? So in here, these are your discs, all right? And these areas right here, well, these are your bones, your vertebrae, And by the way, this person has pain in the back of their leg. So it's probably an S1 nerve problem. So L5 S1 disc issue. L5 S1 disc issue impacting the S1 nerve. And how do I know that? Because the S1 nerve supplies symptoms to the back of the leg all the way down to the foot into the heel, right? Versus the L5, yeah, the back of the leg, but to the shin. They don't describe shin symptoms. They describe calf symptoms, which tells me it's an S1 nerve issue, most likely caused by, again, a large disc protrusion or disc extrusion, almost without a doubt. Now, if this person gets an MRI, what'll happen is it will show this, something like that, right? And it'll be, hitting the nerves and in the spinal canal. It'll look yucky, right? Really yucky. And so that'll freak the person out. And this is the reason why MRIs tend to cause prolonged pain and suffering by an average of generally at least 4 months or more for folks who get them versus don't. So if you want to experience symptoms longer, go get an MRI. That being said, the worse the herniation, this is something this person should know, the worse the herniation, the better the outcome. So the larger the disc herniation, or the worse, so if you have a disc extrusion, you have a disc protrusion, generally the better the chances of natural relief. So that's something kind of cool, right? And so now, right, that person reduces their sort of anxiety or fear potentially around what they're dealing with, okay? Number one, we avoided the MRI, hopefully. So this way they don't have that picture in their mind. And they know that there's an end in sight. And they are aware that even if it was really bad, they would actually maybe want that, because we know that the chance of them improving naturally in the body, doing what it does best, gobbling up the disc extrusion or healing the larger protrusion, all right, that chance of improvement would be greater. So again, the goal of this education is to reduce fear, reduce worry, reduce concern, reduce anxiety about the problem. And why is this important? Because pain is an experience of both the brain and the body. This is what it looks like. Right? So when you start to hurt, you start to become fearful of movement. When you get an MRI, you start to become fearful of your spine. You move less because you're worried about it breaking, right? You have more fear, you have more pain, and before you know it, you get stuck. All right. So regardless of if the symptoms are of the brain or of the body, it's very important to know some of these concepts and realize and appreciate that pain is an experience of not just the body, but really first and foremost, the brain. Because the body is the instrument of the mind. And without the brain, you would not experience pain. So on the mind side, any beliefs, any fears, any worries, concerns about the ability for a disc to heal, things like that, very valuable. Now, when it comes to optimizing, not only do we look at the mind, but we also look at the body. And so this is going to be super important for this person because, again, the evidence, 69% of it, points to it being a body issue, most likely a disc problem. But regardless of what the issue is, we need to optimize the healing environment. So what we're going to do is we're immediately going to educate this person or someone like yourself who's having trouble, in this case, standing or walking, but it would be the same if you're having trouble sleeping or bending or lifting or whatever. We want to teach you some tweaks or what we call avoidance strategies, such that you can find more comfort while standing and walking. So, if this person does a bunch of exercises, well, then they have to go stand and walk throughout the day because they have to function as a human being, right? Well, then you could have the best exercise in the world, could take your pain completely away, but then you got to stand and walk and it's going to tick it off. So standing and walking sometimes is not avoidable, in case you haven't found that out, right? And so we've got to find tweaks or temporary ways to modify or change what walking or standing looks like or is for this person in order to allow them to sort of calm things down. So at any given point, you can either become your own best anti-inflammatory pill, meaning you can, if you do the right things, aid in calming down your nervous system physically and mentally, calming down inflammation. Or if you're not careful and you continue to partake in the same activities or habits that are ticking off your pain, especially in the early acute phase, as in this 6 weeks, then that's going to be problematic, all right, because you will actually cause an inflammatory response, all right? So Standing and walking. What do I mean by this? And what do I mean by tweaks for standing and walking? We've got to find a different way to stand and walk so this person can tolerate load bearing. So if symptoms are a 90 out of 100 when they walk or when they stand, 90 out of 100, let's just say, really yucky. And the tolerance is very low. A minute, 2 minutes, something like that. I can't exactly recall. We could scroll up, but let's just say that very low. Then this problem is really ticked off. Not only are the symptoms very severe, but the system is very sensitive. It doesn't take much for the fire to get kicked up. All right. And so first thing I'm going to recommend, actually, even this person is young, is I'm going to recommend a walker or a cane. Something to deload, something to reduce how much load. Remember, this person said as soon as they put the weight through their right leg, they're unable to tolerate it, basically, and pretty darn quickly at that. So I'm going to give them a walker or a cane, or I'm going to recommend it. So this all comes down to testing, right? So these are just tests. Walker is one test. A cane is another test. I guess you could use crutches, right? But the idea is some what we call assistive device. Walker would be easier to deload the right leg, so you can actually just kind of use the left leg as you go. By the way, this is not a long-term solution. We don't want to avoid pain for too long, because the more we avoid something, the more we reinforce that it's dangerous. The goal is always to stay as active as possible, but at the same time, we don't want to tick it off. Walker, cane absolutely would be my first recommendation, something like that to assist in the walking and reduce the symptoms. And look, it might not go to a 0. We're not necessarily looking for that at the moment, but small changes compound over time could be big changes. So a 90 out of 100 when this person walks, well, if they use a cane, they might be able to keep it at a 60, right? Which is significantly better. It's not perfect, but it's significantly better. Or instead of just being able to walk for 1 to 2 minutes, they might be able to walk now for 5 to 10 or 15 minutes, which allows them to be more functional. The more functional, the better the better they feel. Generally, the less people hurt, the more functional and productive they can be, etc. Right? Fuels into this whole pain is an experience of the brain and body concept. The other thing would be, we know that bending forward, right? Bending forward, we've got backwards. Forward is yucky. Backwards is yucky. But if the symptoms are on the right side, let me draw a stick figure here. That's my stick figure, looking from the back to the front, all right? This is the right leg. Sometimes what you'll see is that you can, if you zoom in at this area, if you can tilt away from the spine or away from the area of pain, what you'll do is that you'll actually create a little bit of a gap where you can sort of decompress that painful side, right? And reduce pressure on the nerves and things like that that go down the leg. So this person might be able to tweak the way they walk by side bending away from or even towards the side of symptoms. My guess is towards the side of symptoms would be yucky. But this person might have to do something called a zombie walk. Right? And this one guy I worked with actually had to walk a little bit funky for a while. So as soon as he would stand up, he get symptoms. So what he would do is, I think he had, let's just say, symptoms on his right side for the sake of this example. He would tilt to the left, and then as he stood up, he would stand like this, and he would walk like this, right, to and from his kitchen, and then he would be able to sit down and get relief. So he'd be able to function, he'd be able to walk, stand up, move around. This improved his standing tolerance drastically by walking a bit like a zombie. You might say, hey, that's not good, right? You shouldn't do that. Well, the alternative to not walking like a zombie is that you get 80 to 90 out of 100 symptoms. Would you rather have a 0 out of 100 symptoms, be pain-free, or 50 out of 100, 5 out of 10? Or would you rather be at a 9 out of 10? So again, a lot of people will look at this and say, that's crazy. Why would you have somebody walk all kinked over? Because the tendency and the belief is to be like, oh, well, I'm walking crooked. Well, let me try to correct that. Let me try to push my hips back to where they should. Let me try to correct my alignment. You could do that. But how does that feel when you do it? So now, are you just kind of going by what others think or say or feel? Or are you going by what actually feels best? Are you tuning into your own body and your own experience? Because I'll tell you what, this person felt that this was much better, but they believed that they needed to be straight. And so for the longest time, They were forcing themselves upright by doing what we call lots of side glides, Mackenzie press-ups, trying to push this disc back in. And they were just ticking off their symptoms instead of asking the question, or sorry, having the awareness of, well, maybe my body's like this because that's what it wants to do right now. It's compensating for a reason. Should I try to correct that compensation? In doing so, you might be ticking it off. Again, if northbound, forward is yucky and backwards is yucky, and load bearing is an issue, a lot of times bending away from the side of symptoms or even rotating away from the side of symptoms will bring relief. And we'll talk about this again when we go to the third step, which is mind and movement as medicine. So would you rather walk like a zombie? Would you rather walk with a walker? Would you rather walk with a cane? Let's go ahead, let's tweak, let's modify the way that you're walking such that you can find more comfort. There's more tests to this. There's many other tweaks that we could try on to improve the overall walking and standing. Sometimes maybe if walking and standing is too yucky, it's not ideal, but you may have to go to a totally different position. One individual I worked with, none of these things worked. We actually went through many other tweaks or tests to run. And the only thing that we could get them to do, because their symptoms were so acute, is go on hands and knees. They actually had to crawl to and from the bathroom, crawl to and from the kitchen. You might say, well, that's crazy. I can't do that. You can do it. And you're right, that's not walking. So it's not really a walking tweak. But the alternative is that you continue to tick your symptoms off. Desperate times call for desperate measures. And so if you want to solve the problem naturally, you might have to do some funky things. That's step one. We optimize the healing environment mentally and physically. Now, second step is that you can't manage what you don't measure. So how will we know if what we're doing is working or not working? How do we know if, the diet that we're on is helping us lose weight or not lose weight? How do we know, how many cups of something we're putting into a certain recipe? We have a measuring cup. How do we know if something's level or something's the correct length if we're going to cut it? We have tape measures and all kinds of different stuff. So there's measurement devices. But what about for pain? We have this 0 to 10 scale, but I don't know, it's kind of fluffy, right? Because, how bad do you hurt? And they show you these little smiley faces. And while that is something to go off of, I think we can do a bit better in assessment. So what I do is I teach people to self-assess. And again, we provide everybody with a healing log so that they can begin to manage what they are measuring. So let me pull that up and show you exactly what that looks like. We are back to the healing log and we have this weekly tracker. So I took all this from their specific case. And you can see right here, the leg raise right. That was their yuckiest motion. Now I'm going to provide some numbers here, just arbitrary numbers, because I don't know exactly how bad it is, but it sounds like it's pretty darn bad. So what I recommend is that you use a scale 0 to 100. So this is useful because it blows up the problem versus 0 to 10. Sometimes it's hard to tell the difference between an 8 and a 9, but it might be more clear to notice the difference between an 80 and a 90. So we went through all these different motions. Right? I had them go through all these different things as part of the application process to work with us. Needed chest left, figure 4 right, figure 4 left. Now, I don't have these specific scores, but they didn't mark them as painful. So what I do know, though, is that the leg raise right was really yucky. The forward bend center was really yucky. And the back bend center was really yucky. So I know these are their yucky motions that reproduce the issue. And again, this movement pain relationship, when I do this, I get this, consistent with probably sciatica due to a spine problem, along with everything else in the story. Then what I did is I said, okay, of these things, regardless of the diagnosis, how is that diagnosis showing up in the way that you move, you think, you feel, whatever, your life? Let's make it real for you. Person has a yucky leg raise. That's how it's showing up for them. This person has a yucky forward bend. Person has a yucky back bend. And by the way, when we talk about optimizing the healing environment, the reason this is useful too is because we want to start to think of how is it in my life that a yucky leg raise is showing up? Well, maybe the way I sit on my couch at night. Maybe when I'm driving. No wonder I can't sit and drive, Charlie, because that is me kicking my right leg out to reach the gas pedal. There's so many things we can do here. So what you measure informs not only the decisions that you make moving forward, but it also helps highlight the things that you need to be aware of in your day-to-day life that might be picking the scab and keeping you from healing. So we've got a leg raise right, we've got a forward bend center, we've got a back bend center, and I just gave some numbers there based off this yummy yucky scale. Or if it's low, it's a 10, 20, 30, medium 40, 50, 60, high 70, 80, 90. The higher the number, the worse the pain is. And then we've got walking and we've got standing. And it seems as though standing may be a little bit yuckier than walking. So I just gave it a little bit of a worse number. Cool thing about this is now we can track this week to week and we can determine the trend. Is what we're doing working? Is what we're doing the same? Is what we're doing not helping this person, making them worse? It's all just data. There's nothing good or bad about it. And obviously, if something's working, we don't change it. It's a nugget for you. Don't change what's working, all right? If the trend is not going in the right direction and you're feeling the same, something's not working. Guess what? We're not going to keep doing the same thing. If something's worse, we've clearly got to change stuff because we can come back week to week. If those are your scores at the end of week 1, then what you're doing is working better, right? And you're on the right trend. I think you get the concept. You can't manage what you don't measure, and so you have to have a tracking system. All right, be scientific, look at the data, make decisions based off the data, not what you think, not what someone else thinks, not what you feel, none of that. When we're in pain, we tend to go insane. So let's make it as real, as raw, as objective as possible. Step 3, let's talk about what should this person do exercise-wise, or at least how would I begin thinking about using movement as medicine? We're going to talk about movement here primarily. So again, the goal is never to take more medicine than needed. It's to take as much as needed, as little as necessary. So the goal is to find one motion that works for this person and one motion that works immediately in the moment. This person mentioned that what was yucky is forward bending. So forward yucky. With their back, bending forward with their back. Forward with their right leg is yucky. Kicking their right leg up and forward, right leg raise, and bending backwards is yucky. So what do we do? Northbound is jammed, right? Think of this. Your body can only move in so many different directions. You've got never eat soggy waffles. North, east, south, and west. And then obviously you can twist in this case. You can go forward, backwards, sideways to the right, out to the left, or you can twist. You can rotate your body, your trunk, your leg, something like that. And so these are options as it relates to motion. Let's not overcomplicate this. Which direction is my body going to prefer? Again, this person tells you forwards jammed, backwards jammed, and kind of forward to the right is jammed with that leg raise. Well, if you're going somewhere and this way is jammed and that way is jammed, you're probably looking for side streets. You're probably going to take a detour, turn right or turn left. And so that's what we're going to do. What we're going to do is we're going to say, all right, if forwards jammed and backwards jammed, I wonder if sideways to the right will be jammed. I wonder if, this should be sideways to the left. Sorry about that. Wonder if sideways to the left will be jammed. I wonder if forward to the right is yucky. Well, will backwards to the left be yucky? They're opposites. And if the right leg raise is yucky, what about the left leg raise? So there you go. So now we've got a bunch of different options. And by the way, we've also got twists. Now, what I'll tell you is that twisting the spine and kind of bending to the side, so twisting to the right and bending to the right, sort of create a similar type of motion as it relates to deepen the spine at the level of the spinal segment. So we'll kind of say sideways to the right or twisting to the right, sideways to the left or twisting to the left. All right. So to be clear, let's outline the most probable test that we would begin running just based off what this person has provided us. And maybe, again, apply this to your own situation. So sideways to the right. I wonder if this person does a bunch of right side bends in standing. By the way, you can go north, east, south, and west, forward, back, right, and left, and twist. But you have different body positions. You can stand, you can sit, you can lie down, you can lay on your side, your right side, your left side. So there's many different ways, and this creates a sort of motion menu, a motion matrix of options that we can just begin scientifically going through, and I'll show you what I mean by that in a moment. All right, so right side bend. Wonder if that'll work. A right trunk twist. Wonder if that'll work.
Then we've got a left trunk twist. That's this twist. A left backwards motion. It could be a back bend to the left. It could be kicking the left leg back to the left. What about a left side bend? And what about a left leg raise? Interesting. So we're just applying kind of this law of opposites, we'll call it. If righty equals tighty, then lefty equals loosey. If forward to the right is yucky, then we'll backwards to the left be yummy. If going this way is yucky, what about going this way? This way. If going this way doesn't work, what about this way? The left leg raise. And so there's two prerequisites when it comes to using movement as medicine. Number one, in most cases, the motion or thing which you decide to try on must be yummy. It must be safe is maybe a better way to say it, mentally and physically. If you feel threatened by doing a motion mentally, the chance that you're going to respond physically to it in a favorable way is not good. So it's got to be yummy or safe. The chance that you're going to do a motion which hurts so good and then not hurt is not very high. So it's got to be yummy. And then two, it's got to immediately, not tomorrow, not later, immediately make you feel better. And when I say make you feel better, just take the emotion out of it. Make how this problem is showing up for you feel better. It's got to immediately improve your movement experience. So these are all different tests. All right, we've got 1, we've got 2, we've got 3, we've got 4, we've got 5, we've got 6 tests of potential motions, at least at a very high level. And again, when we work with folks, we walk you through all of this. We outline the exact motions that you need to begin testing in the exact order you need to begin testing them to give yourself the fastest, most effective, best chance of solving this. And so when I say immediately makes you feel better, well, here's what we do. So notice this little tab down the bottom. There's something called a hunting log. Now, I sort of simplified this so you can see the concept, but again, I've pre-filled this in. Back bend is an 80. Let's just say it's a really yucky motion. Well, we want to see that get better. Well, I wonder if a right trunk twist done at a certain amount of reps or for a certain amount of holds or time will improve that thing or not. So what we would do is we take those 6 different options, for example. In this case, we have this scoring system. Remember, the back bend was super yucky for that person according to their case review. Maybe it is for you. But anything can go in here, and that's the coolest thing. This process is universal. Heck, you could have a neck problem and still take the same concepts. If bending my neck forward is yucky, what about bending it backwards? That's an option. It's yummy, and it might help you. This is how we determine it. We call it hunting for motions. So you've got a back bend, that's an 80. Then you've got something, an input, we'll call it, regardless of the diagnosis. This is not what you think or feel, what someone else thinks or feel. This is, wow, when I do this thing, it feels good. Now, you'll have beliefs around if that thing's going to help you or not. Because like, why would twisting my trunk help me to the right? My symptoms are on the left. Forget about it. Just do it. Just follow the process. Look at the data and then iterate or change based off of that. So we've got this yucky thing. We want to see it get better. We've got a yummy input. Will it work? Very good question. We don't know. But this is why we help you, based off all of our experience of doing this thousands of times, get you to the most likely motion. Find the one thing you need to do to solve the problem. And then what happens afterwards? Well, let's just say you do a bunch of it, reps, holds, and then immediately after, you retest that back bend. Immediately after. So I'm doing the back bend. I'm doing a bunch of this right trunk twist. Then I'm immediately testing it. And you're like, wow, 60. You're done. That motion. Now you might say, well, why would that work? And how would that work? And I thought twisting was bad. That's what you were told. But twisting might be bad for someone else. For you, it feels safe. The chance of you doing something that feels safe here and feels good to your body and you hurting yourself is way low. And it immediately, remember the 2 criteria, it immediately improves your ability to bend backwards. And therefore, you are done. You follow some basic logic. You test, you treat, you retest, follow rules. You test, you treat, you retest, follow rules, right? And we could just keep going. until we find what works. Now, most people will, after we lay out a plan, find within the first handful of motions something that works for them. And this is the only one motion that this person would do if this was the case. Now, this is theoretical, but I wanted to show you a bit of the process. Right? And so this is how we go about using movement as medicine to solve the problem. Hopefully that is helpful. Okay, so we're going to use movement as medicine. And then at some point, right, we've got to get back to life. Now, generally what we see is that when those scores in the healing log on the weekly tracker, because remember, we're measuring all of this stuff, when they get to about 50%, about 50% of what they started. So yeah, this would be it, right? Roughly. So 70 to say like a 30, something like 70 to a 40, pretty close, 80 to a 50, 80 to a 40, 90 to a 40. This is when people are nearly ready to do what I call cross the chasm, all right? And here's what I mean. So there comes a point where when you begin working with us, when you begin just in pain in general, regardless of who you work with, symptoms are very high. And so the brain is very threatened and the body is very threatened, right? And the function is very low. Most people reach out to us when they can't really function, right? And the impact is great enough on their life to where they say, hey, I've got to do something about this. And we talked about the process that we use. We didn't start with motion. We started with identifying ways that this person could walk and stand better. Try out some of those tweaks if you'd like that we talked about, right? We talked about shifting pain triggers, not poking the angry bear and doing things because you've been told to do them, press-ups, cobras to push your disc back in place, and because you've been led to believe you need to correct your alignment ASAP, or else something bad is going to happen, even though your body is doing it for a reason and you're just ignoring the signs of your body. We talk about, hey, maybe don't do those things. And let's actually begin healing by subtraction because less is more. So we remove all these different inputs. We become very scientific and systematic about our approach, and we help you optimize the healing environment physically and mentally so you're not poking the bear. You're not, kind of aiding in your own inflammation. You're not fueling the fire. And then obviously we talked about using some motions that feel safe and feel good, which reduce threat. And then as that happens, your function starts to improve because your symptoms are coming down. And then at that about 50% less, so if this was the 70s, 80s, 90s that someone starts with, in this case, while walking or standing, when they get to those kind of 30s, 40s, then we're generally at a point or an intersection whereby that person is going to come to me and say, you know what, you think I can go back to, try a little hike, right? They're going to have the itch to do so. I think I'm pretty good. I think now I'm ready. But the first few days, first few weeks, the first few months of dealing with a bad flare-up, you're like, no way, no how, I ain't doing that because symptoms are too yucky, your activity function is too low. You just want to be able to do the basic activities. But at some point, as you're about half better, 50% better, and how do we identify that? I don't just say, hey, are you half better? I say, hey, let's look at your weekly tracker. Let's step on the scale to see if we're headed in the right direction. Okay, we are. That's generally the time where we are able to shift from a place of avoidance, tweaks. They're not long-term strategies. They help calm things down to exposing yourself to symptoms. And notice that the graph doesn't look like this. Symptoms have to go all the way down so that your function can start to go up. Sometimes people try to rest away their pain and then they try to just get back to it. But while you're resting and while you're allowing your body to heal and giving it all the great ingredients, right, to do so and creating an environment that is conducive for that happening, the longer you avoid something, the longer you rest, not only are you becoming more deconditioned physically, but you're also reinforcing psychologically that whatever you're avoiding is dangerous. Or I see this all the time. People are like, oh, I'll just avoid weightlifting or going to the gym until I feel better. 3 months later, they go back to the gym and they're scared as all get out to pick something up. And so symptoms don't need to go fully away in order for you to get back to activity. In fact, I would recommend against it. Get to a point where things are at least 50% better, somewhere below this threshold, right? But not zero. And then start doing things. And now for this person, it might be for them to visualize themselves golfing, right? Because if it's not safe here, then it's not safe on the field. And so they might start visualizing themselves playing golf and being pain-free as they're doing so. Then they might go ahead and they might play mini golf. Then they might go ahead and then they might, instead of, hitting the driving range, maybe there's a way to start practicing some shadow swings out back, but just very gently, doing some chip and putt or something like that, right? And then we go back to the driving range, etc., right? And so we're slowly building up this exposure, having safe experiences over time, challenging the body physically, and breaking the pain fear cycle. Wow, I just golfed in my mind or with my body, and I was okay. Golf isn't bad. Walking isn't bad. I went for a hike, and I'm okay. And the more we do that, the more we expose yourself, the more that actually assists in the healing. Exposure to the activities which are somewhat symptomatic, but not so symptomatic that that activity is flaring you up. So one other thing I want to show you. Red light, yellow light, green light. How do I know what to do, Charlie? How do I know if I'm doing too much? In this case, in the early phase, golf is too yucky for this person. Why? Because they're always in moderate to high pain, danger mode. So regardless of the activity you want to get back to, ask yourself, is this activity red light, yellow light, or green light? What's the state that it's putting my body and my brain in? Red light, symptoms are moderate to high. The more you do it, the worse it gets. Things really get flared up very quickly, and it takes a while to simmer down. You can't sleep. You need to take pills. Things are really ticked off. You cannot do that. Avoidance, not complete avoidance per se, but again, this might be tweaks. For this person right now, it's standing or walking, which is why we're talking about a walker, things like that, walking like a zombie, all this weird, funky stuff. Yellow light. This is where we begin exposure. Exposure, which actually assists in reducing the fear and improving the resiliency of the body. Symptoms are mild to maybe low moderate. Then once you stop swinging the golf club, once you stop and sit down for a break after walking, guess what happens? Your symptoms go away pretty darn quickly, and they're not super severe. I do this thing, I feel it, but it's pretty tolerable. And then when I remove that activity, I'm good. Great. I don't have any evidence to believe that that thing which you're doing is causing an inflammatory reaction, causing damage to the body, or that it's ticking you off psychologically so much that you need to avoid it. It's not freaking you out. It's not setting off the bells and whistles to an extent that is causing like re-traumatization, like a setback. Green light, here's the deal. Everybody wants to be pain-free, but if you don't experience symptoms, then pain, as the great teacher which it is, does not have the ability to teach you the lesson that it's trying to teach you, right? So if you don't have any pain, you have no ability to practice changing your reaction to it. And so as much as we want you to eventually become pain-free, it is useful to expose yourself to symptoms when they become mild so that you can start to reduce your fear, your worry, your concern, and then build up your body over time and not wait longer than necessary. All right, so again, yellow light, symptoms aren't perfect. There's still some symptoms there, but they're tolerable. And we start to gradually expose you to things so you can reduce your fear, improve your tolerance. And then we want to talk on the back end about strength, about conditioning. The idea is, hey, you generally can't go wrong getting strong. And so how can we maximize that on the back end? So we would talk about some type of strength training, probably program for this person, but make it meaningful. Maybe you're watching this, you're like, I don't like weights. I don't like working out. Okay, that's fine. How can we tie in some of the activities you like? Maybe golf. Maybe pickleball, maybe walking, and make it more challenging such that you can increase the resiliency of your body, not only short-term in the moment, but then also long-term as far as potential prevention, but then also just like health and well-being. That's the process. You've seen it all. This is the story. Potentially you have a story like JT, and you're looking for a way out. You're looking for a natural solution to solve it. You don't want pills, shots, or surgery. This is the exact process that we would walk through. A to Z, you can see just by reviewing someone's case how much information we can get and how we can start thinking through the exact process, not only the diagnostics of it, what is it? Is it brain? Is it body? But within the body or within the brain, what's happening there based off the story, location of symptoms, and the movement exam, all things which we ask you to go through. Then we can start to plug this into a process that we've used with thousands of people. Myself as a specialist in orthopedics, and somebody who only helps me with back, butt, sciatic problems all around the world, right? I sort of perfected this process. We can optimize things first. You cannot exercise the bad diet. We know exactly what to track, and we can lay that out for you. We know exactly the process that we need to begin using as it relates to movement as medicine, and also the mind, but in this case, not as much. And then talking about getting back to life and helping you identify when you should do that. Optimizing things by using tweaks, changing beliefs, fears, worries, concerns, and the knowledge that you have about what you're doing so you can reduce the fear and all of that surrounding it. Because remember, pain is an experience of both the brain and the body. And then as it relates to the physical body, moving yourself in ways, positioning yourself in ways that allow you to reduce your symptoms and feel more comfortable, which aids in the reduction of inflammation if it is a structural problem, right? And allows the body to better heal. Self-assessment, talked about that. We want to look at and put emphasis on the data, making decisions based off the data, not based off the emotion of things. And then movement as medicine, right? We use kind of this law of opposites to start to solve the problem and start to explore at least potential options initially to begin trying on. All inputs, exercises are neutral. They're not good nor bad. They are just what they are until tested and proven otherwise. And so we showed you a little bit of the hunting for emotions process and how we test, treat, retest to find something that is not only yummy or safe, but immediately improves what you're doing. This way, you're not just waiting to see if a treatment works. And then we talked about the exposure process that we use when we do it, sort of the metrics that we use, meaning, okay, when I look at my scores and I get here, generally, what does that mean? I gave you some rules of thumb there. And then also sort of this decision-making framework or logic for figuring out, am I okay to engage in activity? Or is what I'm doing too much? Or are symptoms too good at the moment? And maybe if I had more symptoms, I would have a better opportunity to change the pain I'm experiencing long term.
All right, so hopefully this case review breakdown was useful. It gave you an outside-the-box way to think about how to solve this problem systematically, scientifically, methodically, not doing a bunch of random things, and in a step-by-step way so that you can become more self-sustainable, so you can solve this naturally versus relying on something outside of you, a machine or a device, or someone outside of you to fix you. Instead, I'm a big proponent of teaching people how to heal themselves so that, again, you can solve the problem not only now, but then this person in the future will know exactly what they need to do. God forbid something pops up. So hopefully it was useful. Let me know your thoughts in the comments. What was the most valuable piece of information that you learned from this? And how can you begin applying these concepts to your own situation? If you're interested in potentially working with us and having me review your case, just click the link below in the comments or in the description to apply to work with us and then follow instructions to submit a case review. Thanks so much for watching.